Medical nanotechnology, revolutionizing cancer treatment. In recent years, medical nanotechnology has emerged as a breakthrough field in medicine, particularly in the treatment of cancer. With its immense potential to revolutionize drug delivery, targeted therapy, imaging techniques, and more, medical nanotechnology holds promising prospects for enhanced patient care and outcomes. In this comprehensive script, we will delve into various aspects of medical nanotechnology, exploring its applications in prostate cancer treatment and highlighting key concepts such as nanoparticles in drug delivery, targeted therapy, imaging techniques, theranostics, nano-based sensors, photothermal therapy, hyperthermia, gene therapy, bioinformatics, clinical translation, and more. Let's begin our journey into the fascinating world of medical nanotechnology. Prostate cancer is a prevalent disease that affects millions of men worldwide. It arises when abnormal cells in the prostate gland start to grow uncontrollably, forming tumors. To effectively combat this disease, early detection is crucial. Medical nanotechnology plays a vital role in improving diagnostic methods, such as utilizing nanoparticles as imaging agents or biomarkers for detecting prostate cancer. These nanoparticles can enhance the sensitivity and specificity of prostate-specific antigen (PSA) tests, providing more accurate results. Moreover, nanotechnology-based biosensors enable real-time monitoring of prostate cancer biomarkers, aiding in early detection and personalized treatment strategies. One of the key areas where medical nanotechnology has had a tremendous impact is in drug delivery. Nanoparticles, typically ranging in size from 1 to 100 nanometers, offer unique advantages over conventional drug delivery systems. They can encapsulate anti-cancer drugs, protecting them from degradation and improving their bioavailability. Nanoparticles also exhibit prolonged circulation time in the body, enabling controlled and targeted drug release directly to cancer cells. Surface modifications of nanoparticles with ligands specific to prostate cancer cells further enhance drug delivery efficiency. Collectively, these advancements in nanoparticle-based drug delivery systems have shown great promise in enhancing the efficacy of prostate cancer treatment while reducing side effects. Traditional cancer treatments often have limited effectiveness and can cause harm to healthy cells alongside cancerous ones. However, medical nanotechnology offers a groundbreaking solution through targeted therapy. By utilizing nanoparticles functionalized with specific ligands, drugs can be selectively delivered to cancer cells while sparing healthy tissue. This targeted approach minimizes systemic toxicity and enhances the therapeutic index of anti-cancer drugs. The ability of nanoparticles to cross cellular barriers, penetrate tumor tissues, and release drugs at the intended site plays a pivotal role in enhancing the effectiveness of targeted therapies in treating prostate cancer. Passive targeting is a mechanism by which nanoparticles can accumulate preferentially in cancerous tissues due to the enhanced permeability and retention (EPR) effect. This effect arises from the leaky and disorganized nature of tumor blood vessels, allowing nanoparticles to extravasate and accumulate within the tumor microenvironment. Passive targeting exploits these characteristics, allowing nanoparticles to accumulate at higher concentrations within the tumor while minimizing accumulation in healthy tissues. By leveraging the EPR effect, medical nanotechnology provides an avenue for preferential drug delivery to prostate cancer cells, maximizing treatment efficacy. Accurate visualization of tumors during diagnosis and treatment monitoring is paramount in effectively managing prostate cancer. Medical nanotechnology offers innovative imaging techniques to improve visualization and identification of cancer lesions. Nanoparticles can be engineered as contrast agents for various imaging modalities, including magnetic resonance imaging, MRI, computed tomography, CT, positron emission tomography, PET, and optical imaging. These nanoparticles provide enhanced contrast, allowing for more precise tumor localization and assessment of treatment response. The integration of nanotechnology with imaging techniques holds great promise for early cancer detection, accurate staging, and individualized treatment plans. Theranostics, a combination of therapeutics and diagnostics, is a rapidly evolving field empowered by medical nanotechnology. It involves the simultaneous application of imaging and therapeutic capabilities within a single nanosystem. Theranostic nanoparticles enable real-time monitoring of drug delivery, therapeutic response, and disease progression through non-invasive imaging techniques. Moreover, these nanoparticles can be engineered to deliver therapeutic payloads directly to cancer cells while being tracked in real time, personalizing treatment strategies for prostate cancer patients. The integration of diagnostics and therapeutics in a single platform holds immense potential to revolutionize the way we approach prostate cancer treatment. The development of nano-based sensors has revolutionized cancer diagnostics and monitoring. Nanotechnology enables the fabrication of highly sensitive and selective sensors capable of detecting minute changes in biological markers associated with cancer. In prostate cancer, these nano-based sensors can detect specific biomarkers like PSA, providing early indications of disease progression or recurrence. These sensors offer rapid and robust detection methods, aiding in timely intervention and response. Furthermore, nano-based sensors can be integrated into wearable devices or point-of-care diagnostic systems, making healthcare more accessible and efficient in the management of prostate cancer. Photothermal therapy leverages the ability of nanoparticles to convert light into heat, selectively targeting and destroying cancer cells. By utilizing nanoparticles with plasmonic properties, such as gold or silver nanoparticles, localized hyperthermia can be induced within tumor tissues upon irradiation with near-infrared (NIR) light. The heat generated by the nanoparticles leads to cell death, providing a non-invasive treatment strategy for prostate cancer. Photothermal therapy exhibits superior selectivity, minimal damage to surrounding healthy tissues, and reduced side effects compared to traditional treatments. This innovative approach holds tremendous potential for localized tumor ablation and precision medicine. Hyperthermia, the deliberate elevation of tissue temperature to induce cell death, has emerged as an effective treatment modality for prostate cancer. Medical nanotechnology enables precise and controlled hyperthermic therapies through the integration of nanomaterials. Magnetic nanoparticles, for instance, can be targeted to prostate cancer cells and subsequently exposed to alternating magnetic fields, generating localized heat and inducing tumor cell death. Nanotechnology-based hyperthermia holds promise as a complementary treatment strategy, enhancing the efficacy of other therapeutic approaches such as chemotherapy or radiation therapy. The ability to precisely localize and control hyperthermic treatments is a significant advancement in prostate cancer management. Prostate cancer is characterized by various genetic alterations that contribute to disease progression. Gene therapy utilizing nanotechnology offers exciting opportunities to modulate gene expression, inhibit oncogenes, or deliver therapeutic genes for the treatment of prostate cancer. Nanoparticles can efficiently deliver therapeutic nucleic acids, including small interfering RNA, siRNA, or plasmid DNA, to target cancer cells. These nanoparticles protect the nucleic acids from degradation, promote cellular uptake, and enable sustained release, ensuring prolonged and effective gene therapy. The combination of nanotechnology and gene therapy holds immense potential for targeted inhibition of cancer-specific genes or the delivery of therapeutic genes to restore normal cellular functions. Bioinformatics, a rapidly evolving field, plays a significant role in the development of nanomedicine. By integrating computational approaches and data analysis, bioinformatics allows for the identification of novel drug targets, personalized treatment strategies, and prediction of treatment responses. In the context of prostate cancer, bioinformatics analysis can aid in the identification of genomic alterations or biomarkers associated with disease progression, enabling targeted therapeutic interventions. The integration of bioinformatics and nanomedicine facilitates a data-driven and precision-based approach for managing prostate cancer, transforming patient care with tailored treatment plans and improved outcomes. The successful translation of medical nanotechnology from laboratory research to clinical practice is essential for its full potential to be realized in the treatment of prostate cancer. Clinical translation involves extensive preclinical studies, rigorous safety evaluations, and regulatory approvals. Through collaborative efforts of scientists, clinicians, and regulatory bodies, nanotechnology-based therapies have entered clinical trials, with some already approved for clinical use. However, challenges such as scalability, manufacturing, and cost-effectiveness need to be addressed for widespread adoption. Continued research, technology refinement, and interdisciplinary collaboration are vital to expedite the clinical translation of medical nanotechnology, ultimately benefiting prostate cancer patients globally. Medical nanotechnology has ushered in a new era of cancer treatment, particularly in addressing the complex and multifaceted nature of prostate cancer. From improving diagnostic techniques to enabling targeted therapies, enhancing imaging capabilities, and facilitating personalized medicine, medical nanotechnology offers unprecedented opportunities to combat this prevalent disease. The applications of nanoparticles in drug delivery, theranostics, and hyperthermia showcase the immense potential of medical nanotechnology in revolutionizing prostate cancer management. However, it is crucial to continue scientific exploration, address technical challenges, and foster collaborations to ensure the safe and effective translation of these advances into clinical practice. As we embark on this fascinating journey, medical nanotechnology undoubtedly holds the promise of enhancing patient outcomes, improving quality of life, and shaping the future of cancer treatment.